Terminal illnesses have become a problem in Uganda, with cancer and HIV/AIDS posing a threat to development. There seems to be no clear policy on palliative care, although some institutions are providing it. Ahabiona Francisco takes you to Busoga sub-region, where terminal illnesses have become a serious threat.
Before I was operated upon, something protruded out of my nose until I was operated upon 4 times. I often get bleeding through the nose and mouth. I bleed profusely.
These are some of the common cases caused by terminal illnesses affecting people in Busoga sub-region. Uganda's health services seem to have a problem. 3 phases of health concern a new nation like Uganda: preventive medicine, curative medicine, and care for the terminally ill. Today, the health services of Uganda are overburdened because of 2 heavy areas. Curative and care are taking a lot of resources. What is government policy on health? The health policy seems to be heavily committed to curative methods than preventive and care.
Presently, as we talk now, this hospital serves about, we have said it's a 500-bed hospital, that's about 500 inpatients every day. And through our gates, we see close to about 1,000 outpatients. That is the adult, and the children. On the children's hospital, we see close to 200 children inpatient, and we see about 500 outpatient. It means that we have diseases that are beginning to emerge, which are non-infectious diseases, which fall in the category of the chronic illnesses. Among the chronic illnesses that we are beginning to see is the burden of cancer.
Cancer is a real burden to Uganda's health service systems. Care for the terminally ill patients, in other words, palliative care, is demanding. In Busoga sub-region, where the population is 2.1 million, there are 110 patients with terminal illnesses, including tuberculosis and HIV patients. An NGO, Rays of Hope Hospice Ginger, supported by the Irish government, are offering palliative care services to patients in 8 districts of Busoga sub-region, including Buikwe district in central region.
We work across the 7 districts in Busoga region, and we cross over to Buikwe district, part of it, close to the bridge, and look after also some patients there. Hospice Ginger works with the cancer, HIV and AIDS patients that their illness has reached a level that cannot be cured. So they need to be helped to be comfortable, pain-free, and die with dignity.
Zalika Navirie, a widow, is 72 years old. She lives at Bukona village, Nakalama sub-county in Iganga district, in pain. She suffers inverted papilloma, a cancer that attacked her nose, claiming one eye, leaving her face deformed.
I went for medical checkup and I was diagnosed with cancer. It started with headache before my husband died. I went for treatment, after which I got relief.
Now, how we look after these patients is in 3 ways. Those that are very sick and are bed-bound or house-bound, we find them in their homes, and that's what we call the home-based care for the patients. But there are those that are still a bit strong. They could walk to the health center, so we treat them at the different health centers across the districts. Then there are those that are within Ginger Town. They walk to our clinic here, and we look after them, treat them from our clinic.
Terminal illnesses that are appearing in our health scene seem to be common among the elderly and the poor. The elderly, mostly women. The poor seem to be increasing in numbers in Uganda. The reason: poor feeding, poor education, poor attitude and practice. The terminal diseases do not only burden our government, but also a burden to the family who are too poor to maintain them. There are signs of extreme adversity. Yet, still hope to those where palliative care services can reach. Banji Zeulensi, 78 years, lost her breast to cancer. Rays of Hope staff visit her often to help her caretaker, Rebecca Kauma, attend to her.
This pain is too much.
The patients need counseling to return to a portion of uncurable care as an advantage of sick people at this vulnerable stage.
Emphasis is on to try to improve her quality of life, and we do that by addressing her various symptoms, namely her pain, which she's on oral morphine for, and also the infective discharge that she's getting from her cancer area, and we do that by giving her some metronidazole.
Community volunteers normally seek out these patients from the villages. Most of these patients are unaware of the services offered to them. Mary Mukabire and Bana Nakayaga are based at Busembatia Health Center 3.
Abalwadde ba mirundi ebiri, aba cancer n'aba HIV positive.
Some patients, they get them when they are bedridden, they're in a lot of pain, so when they come in and help them, others improve, others don't, because at times they come when they are in late stages.
Janet Naiwumbwe, 52, lives in Busembatia Town Council. Has been too weak to walk to feel better after spending a lot of money with a Chinese group, resulting into nothing. So, the burden is on. The diseases are increasing. The villages must be reached.
These people are terminally ill. They have no hope. So our going in there is to add them some hope. The challenges we normally face when we go to the field, sometimes we find the patient, the real patients we are supposed to care for. Some of them we find they have been abandoned by relatives. Our patients, they present when it's too late. Those ones who would really actually be helped on time, because they go to these these local doctors, because they are nearest to the community and easily accessible.
It is the care which is expensive. Health care for the terminally ill has become a burden. Ahabiona Francisco, UBC News.